Recently, I've been involved in the new GP commissioning, sometimes known as clinical commissioning, and I'm helping lead that. It's an important piece of work, and it's allowing local GPs and clinicians to have much more say in designing and trying to organise the types of healthcare that we believe our patients need. The big challenges for people and their healthcare living in the Orpington area are going to be influenced by the fact that people are living longer lives. So we've got an older population. We've got people living with long-term conditions, mental health problems, but also conditions like obesity, high blood pressure, other types of circulation disease, heart disease, diabetes. And this represents a big challenge because these are conditions that need to be managed with the patient and the doctors or nurses looking after them over a long period of time. We think the solution is to look at the resources that we've got within the NHS and really focus the care on the place that's going to have the biggest impact. So that means definitely having good specialist services, but those are for people who are ill and have quite complicated health needs. And we need to get care out there to where people are going to be most of the time in the community, so that we can focus on managing and helping people with their long-term conditions. We'd like to see a health and wellbeing centre developed. So being able to get people to one place where perhaps they can go for their blood test, see the doctor, specialist nurse, perhaps see a physiotherapist, all of those health professionals and also other members of the wider community team to work in one place, so we can come together around the patient rather than the patient having to go to lots of different places to access all of those services. In the Community Health and Wellbeing Centre, you've got an option to not only get services that your GP might be organising, but also attend services provided from specialist community services, but also perhaps to get your x-rays and your blood tests done all in the same building. Another option is to have a smaller local health centre which focuses on bringing GP practices together. It does allow the GPs to perhaps extend some of the scope of services that they provide currently. So, for instance, might make it easier to look after certain conditions like diabetes and COPD, that's a breathing disorder, and perhaps to offer some extra services like blood testing.
Increasingly, patients are being given more choice about where they can go to for their healthcare. In some specialties, for example in rheumatology and in gynaecology and dermatology, we now have a lot of community clinics set up across Bromley, and patients can choose any one of these to go to, and there are often a choice of days, for example clinics in the evenings and weekends, that they can choose to go to if more convenient. Only some of these patients will require coming into the hospital services. At the moment, the outpatient clinics are working in isolation. The doctors are working in a clinic apart from their other medical colleagues, apart from where the diagnostic tests are performed. There is no pharmacy for patients to be able to get their medications on the day, they have to go elsewhere, and they often have to come back for other visits. One of the other problems that we have is a lot of the building is not fit for purpose. The clinic rooms are too small, so we cannot get patients with wheelchairs or patients with prams into any of the clinic rooms very easily. And particularly for the dermatology department, where there is a day treatment centre, we cannot separate the sexes, and we have men and women having their treatment in the same room. And if outpatient clinics are based at the acute site or at a site where other specialists are available, you can have doctors discussing complex conditions between them, and patients can have their tests done in the same place rather than having to go elsewhere for further tests.
Intermediate care is a range of nursing, therapy, social care services with medical support, which are designed to keep patients either out of hospital or to enable them to move home as quickly as possible following a stay in hospital. The aspiration for the future of intermediate care is more home-based care. It is important that we are able to manage patients in their own home, to rehabilitate them to best effect, and that is always going to be achieved in their own home. The vast majority of patients are very, very keen to receive their services at home. Most people naturally do not want to go into hospital unless they absolutely have to, and if you are in hospital, you are of course keen to get home as quickly as possible, and to receive that rehabilitation in the environment in which you live, which the rehabilitation is tailored to, will really deliver the best result for the individual.
One of the challenges facing us as clinical commissioners, as well as achieving the better health and better care that we want to see, is making sure we get the best value from the resources that are at hand. We're anxious not to see resources that really should be spent primarily on providing good quality services spent on repairing buildings and keeping buildings afloat, without necessarily being the right size or in the right place to provide those services. I'd like to see a legacy for the future for healthcare in Orpington. I think one of the things I've been struck by in talking to people from Orpington is that they're quite passionate about having a local healthcare facility in their area. And I'd really like to see a collection of services based in the centre of Orpington that means we can provide services into the future that are there for you when you're ill, but also enable you to stay healthy and look after yourself. And I think that is a really exciting prospect.